Hello, Mia. I'm so excited to have you here and that you'll be commenting and talking about what is so important about the mouth health, oral health, dental health, and how it relates to bone health and how the osteoporosis drugs may impact bone health, osteonecrosis. So I'm going to ask you if you can introduce yourself and tell my audience who you are. I will say how delightful you are, but tell us who you are and how you came to the mouth.
Hello, Irma. Thank you for making this possible. I feel really honored and I must say comfortable. I'm a long-living plant with a few careers in my luggage. So my first half of life was pediatric dentistry and preventive dentistry, teaching and working and mentoring in university settings for almost 20 years, from early 90s to mid 2000, when I've decided to settle in Canada to live with my family in Montreal. And over here, I reached out for the preventive part of the dentistry, which is my real passion, and it's my life philosophy.
And do you recommend brushing twice a day?
Brushing twice a day has a very good point, and I'll tell you why it's usually sufficient to brush twice a day. On the smooth surfaces of the teeth, which we can access with a brush, and that's the front and the interior, we cannot really brush between teeth with a brush. On those surfaces, we have biofilm that can form in, we say, critical mass to lower pH, to make acidic environment, which can affect the tooth enamel to demineralize, to start the caries process. That critical mass is attained every 12 hours. So that's the logic behind twice a day. In the morning, you brush everything that's been attached during the night. And in the evening, after your supper, you take care of those colonies that were attached during the day.
Thank you.
A little bit about what we can use. There are different means to expose biofilm, so you can see exactly how you're brushing. My favorite is this plaque HD, a toothpaste that you can find because it's green, it contains chlorophyll. And when you brush regularly, as you do, what you do, you spit vigorously and rinse maybe only once, and then look in the mirror and see where the green is still there. So there your brush should go back.
No.
Yes, it's a fantastic thing. I love it. It's
Really?
a regular toothpaste. It's a bit expensive, but it's really worth it because by the end of the tube, I guarantee you're going to master all your movements and everything is going to be fine.
Oh, that's such a very important tip. Thank you for that, Mia.
Yes.
While we're talking about this, toothbrush, do you think soft toothbrush? Do you believe in the sonic toothbrushes, the floss, the water floss? What? Tell me about the brushing that you prefer. Electric toothbrush or manual toothbrush?
Well, first I have to say, brush is the mean in our hands. So if you like electric toothbrush, please use it. If you feel comfortable and completely skillful with manual one, please use it. I recommend soft toothbrushes because you're brushing your organs and your soft tissues and not shoes. So even shoes take some time to be brushed. I like soft touch. So if I use manual toothbrush, I hold it like I hold a pen.
Mhm.
and approach my bristles to the gums. I turn them slightly to the gums, and I do miniature infinity size, half gums, half tooth, because over there I have a crevice which can be filled with biofilm. So I want to take it out from there first. And I do it nicely. I visualize that my bristles remain straight all the time, because if I pressure on my toothbrush, those bristles are going to completely go sides. Nothing will be brushed. Hard toothbrush or medium or whichever will not allow you to brush long enough, because it's not comfortable.
Mhm.
You're going to have that scratching sensation. It's going to be irritated if you sit there as long as you need to remove the biofilm. So the thing is, mathematics. Let's say we have 28 teeth. Out of those 28 teeth, we have 8 molars, 8 premolars. So we have 16 teeth with 5 surfaces, out of which 3 surfaces times 16 have to be brushed by a toothbrush, because others are between teeth. So if you stay there, like counting to 10, which will be the good time to remove the biofilm, you'll see easily how we can debunk that myth of 2 minutes. It takes much longer.
Mm.
So the length of duration of the brushing is the best kept secret of the success in the oral health,
So the longer, the better, the softer, the better.
because the biofilm is sticky. So just like you would clean any surface as long as
This,
soil, that's exactly how you do it.
that's why the plaque HD would benefit the individual to see.
Exactly. This is the image, yes, of the position of the toothbrush. I was mentioning earlier how we turn bristles slightly to the gums. So when it's in the upper jaw, it's up. When it's in the lower, it's low toward the gums, just to brush around that crevice, the gum line, because over there is the most hidden and packed biofilm between the gums and the tooth.
So let's go through the rest of the products that you're identifying, and then let's talk about flossing. So let me go back to the electric toothbrush and the electric flossing, the water pick.
Water floss.
Do you like that?
I do. It's all the means. I have to tell you, I'm not biased. I love them all. I just want to be sure that the indication is right for my patient,
Yes.
that case is actually solving the needs for my patient. So I'm not refraining from anything. Those are only means, like cars, like if you ask me if I like convertibles, I do, but they are not good on Canadian winter. So things like that.
So,
Only for summers.
but
Yes.
here's the thing.
Yeah.
When I was sick with COVID,
Mm-mm-mm.
my joy, believe it or not, because I was relatively bored, was to have the flossing, the water pick. And I was absolutely shocked what came out of my mouth after brushing. I brushed the teeth and then I flossed. I was like,
Yes.
how could that be? How could that be? So that awakened me during the COVID state, awakened me to this is very important to do. So I'm very committed to the water pick and the floss pick.
Yes.
The
Yes.
terminology for it.
Water pick, I do find a very good helper
Mhm.
to whether you're going to use floss or you're going to use interdental small brushes, that look like Christmas trees, which
Yes.
I find probably the best interdental mean in removing biofilm from, each side of the tooth. However, not always we can pass them, or not always we take enough time to help our patients learn how to do that.
So then
Yes.
what about regular flossing versus the little Christmas trees between our teeth?
Depends again. of the position of the teeth, of the need, if the gums are recessed, so we have a triangular space that needs to be cleaned a little bit deeper, those brushes will help better. And of course, Waterpik is mean that helps first all of us. We can all use it no matter what. It's not a replacement for flossing or passing the brushes. However, if my patient cannot, for any reason, use any of other means, Waterpik is the king. So
Yes.
my patients who are suffering from later stages of Parkinson's disease, they're autonomous in their teeth brushing and cleaning thanks to Waterpik.
Well said, Mia. Well
Yeah.
said. Thank you.
Yes. So a little bit just of this. So we have here supplements which contain calcium carbonate in order to block some channels of dentin if we have sensitivity. Sometimes it works, sometimes it doesn't. We have mouth rinses, alcohol-free. Mouthwash is a therapeutic thing. It contains alcohol and it's prescribed. Mouth rinse is something that you can buy like this. It does not contain alcohol, but it contains certain concentration of fluoride, sodium fluoride, which can help for some patching on the surface if used properly. And here we have finally Zilamelts, which is xylitol, and that's the only indicated by Health Canada here. I don't know about US, but this is the only ingredient indicated for saliva stimulation.
So Mia, how do people get in touch with you?
So thank you for asking how people can best contact me. I think the email is the best mean because I'm really eager reader. I answer all my emails and it's in the bottom of this page.